Essentials for Health is a name I chose because I think that food is a huge piece of getting well, but I don't think it's the only piece. I think that it's essentials. There's many things that are essential. Exercise, there's things that are important that are, the food aspect, also decreasing stress. And so I team with a lot of professional people so that we have a team of people working. I have people that work on pain. I have Caroline Thibault, she's here today. She works on a lot of my clients who have stress. She does massage therapy and other modalities that she can talk to you more about that she does. I have Carl Huey in the room. Carl, I do a lot of things with autoimmune, which is triggered by chemicals. And Carl, if you know him, he owns Pacific Heights Cleaners, used to be Sunshine Cleaners, Pacific Heights Cleaners in Sausalito in San Francisco, and he helps me with people that I've identified that have issues with chemicals, and those chemicals are triggering their autoimmune conditions. It's not just the food, it's also the chemicals. So I partner with Carl as well. And so I think it's just really important that it's understanding that food is a basic foundation, and just finding out what foods can be causing an issue for you can take away a lot of pain, memory loss, fatigue, all different kinds of things that we're suffering from. And so in my practice, I do a 45-minute consultation. People can come in complimentary, bring in their issues, bring in their blood work. Having worked in a hospital, I'm very up on those kinds of things. And I can look at that and we can really sit and talk about how this kind of a program can work with them. So in other words, not writing a diet, but coaching someone through 3.5 months of taking them through the steps, getting the foods out, getting the foods back in, figuring out what's going to work for them, starting to reduce medications, working with their doctors. And so I complimentary do this 45 minutes. We find out where they want to go, and then if they're ready and if they like me, we work well together, we can move on. And so I brought my assistant here today too, my office manager, Michelle. So if anybody has questions too, if you want afterwards, I can answer questions. She'll be here to answer questions. And there's several people in the room that actually have gone through my program. I can't divulge that because that's HIPAA information. But if they choose to tell you, then they can talk to you about having gone through my program and what it has done for them. So. What the blood test does is that when an individual's blood is put on all the different things that I talked about, 200 different foods, molds, chemicals, what will happen is the white blood cell of the blood actually has a reaction. The volume, size, and all this changes when they put the two together, that person's blood and an antigen and enzyme of that particular food. It actually, they're looking, I'm not doing it, this is a lab that's doing it, they're watching for a reaction. There's also things in the immune system called cytokine markers, and that is how the immune system talks to itself, and they can see a reaction in the cytokines, and that's when they give me back a report. They're reporting what degree was that particular food reacting when they put that person's blood in that food, or that chemical like chlorine or fluoride, or formaldehyde, or these different things that are in the things that we're exposed to every day. Because in the beginning, depending on how sick the person is or how many issues they have, their list may be long, like this young man, okay? But a lot of people, it's not that bad, and within 2 or 3 months, they're back eating a good portion of the foods. And there's a few foods they can't eat. I mean, I'm sure today there were people that didn't eat the salmon, there were people that didn't eat the chicken. Most of us, when we go to dinner with our friends, if they know that, especially my clients, most of my clients have got an issue. They've got something going on that has debilitated their life. And they explain to their friends, gosh, I'm working with a nutritionist right now, she's got me on this program. And most people are very good about saying, what is it that you can or cannot have? And it really is in general categories. I mean, most people can have a lot of the foods that are there. And when you go to a restaurant, when I use a menu, like say the asparagus is with the chicken and the broccoli's with the beef, and I want to have the chicken and the broccoli, I just, obviously they have it in the kitchen, I just make my own menu. I just say, can I have this and this? And I don't make a big deal feel of it. It's not like people sitting at the table going, oh God, there she goes again. People don't even know. I'm sitting talking to the waiter privately, and my dish comes and nobody even knows what's going on. You know, I teach people how not to be a spectacle, because nobody wants to be the person that has all the issues. You know, they don't want to be the pain in the butt, you know, kind of thing. So we teach you how not to be that kind of person.